Good morning, everybody, and very welcome for joining us. We are broadcasting live here from the CMH Family Medicine Boardroom. This is Dr. Madeleine Muller speaking, one of the family physicians. And we are very pleased to have Dr. Unathi Nong, one of our doctors here at Family Medicine, who's going to be presenting for us on stroke and TIA. Thank you. I'm going to hand over to her.
Good morning, everyone. I'm Dr. Unathi Nong. I'm a medical officer here at CMH Ward 5, and I'll be presenting on strokes and TIAs today. The information on my presentation, the theoretical part is mostly from UpToDate, and then the management is from the standard treatment guidelines. All right, so stroke, they are the second leading cause of death worldwide after ischemic heart disease. They are the third leading cause of death in South Africa. Approximately half of stroke sufferers demise within a year, and the stroke burden is higher in rural South Africa. While they only have 20% of the population in South Africa, they carry half of the stroke burden. Strokes basically bring a whole lot of morbidity. All right, so going through the definitions, a stroke is the acute neurological injury that occurs as a result of brain ischemia, which can be secondary to thrombosis, embolism, or systemic hypoperfusion. And then they can also be a result of brain hemorrhage secondary to an intracerebral hemorrhage or a subarachnoid hemorrhage. Approximately 80% of strokes are due to ischemic brain infarction and 20% due to brain hemorrhage. So there are three main subtypes of brain ischemia. There's thrombosis. Thrombosis is generally due to local obstruction of an artery. This obstruction may be due to a disease of the arterial wall, such as atherosclerosis, dissection, or fibromuscular dysplasia.
More of beauty.
Can someone please mute, please? Thank you.
In the case of thrombosis, there may or may not be an actual superimposed thrombosis. And then embolism refers to particles of debris originating elsewhere that block arterial access to a particular brain region. Systemic hypoperfusion is a general circulatory problem resulting in reduced blood supply to the brain and usually other organs as well. Some examples that can lead to systemic hypoperfusion and will also lead to brain ischemia are in the case of an MI when there's reduced cardiac output, or hypovolemia, maybe in a patient who's had a terrible AGE, or in the case of massive hemorrhage. All right, so thrombosis is divided into large vessel disease as well as small vessel disease. Thrombosis produces a stroke by causing reduced blood flow distal to where the thrombus is by a fragment or by a fragment that embolizes to another artery. It is classified into large vessel and small vessel. In large vessel disease, it's thrombus or carrying in the common carotid artery, in the internal carotid artery, in the vertebral arteries, the circle of Willis, and its proximal branches. Atherosclerosis is the most common cause of large vessel disease. In patients with thrombosis, the neurological symptoms often fluctuate, as you see on the graph there, with times of remission and then times of the neurological symptoms being worse again. So it comes in a stuttering fashion. And then in the case of small vessel disease affects the intracerebral arterial system, specifically the penetrating arteries that arise from the distal vertebral artery, the basilar artery, the middle cerebral artery, and the arteries of the circle of Willis. These arteries thrombose due to lipohyalinosis, which is common in those patients with hypertension, especially uncontrolled hypertension, or due to atheroma formation. A stroke due to obstruction of these vessels is referred to as a lacuna stroke. Penetrating artery occlusions usually cause symptoms that develop during a short period of time, hours or at most a few days, compared with the large artery-related brain ischemia. And then in this case of small vessel disease as well, the neurological symptoms are usually fluctuating. And then this diagram basically shows the different causes, or rather the subtypes of the ischemic stroke. So you've got the non-small vessel disease stroke, non-embolic stroke, which would compose the systemic hypoperfusion as well as the large vessel thrombosis. And then we've got stroke due to small vessel disease. And then we've got embolic stroke. So the embolus can originate from a cardiac origin, like in the case of valvular disease, or like in infective endocarditis when there's vegetations that embolize, or it can be artery to artery, like in the case of atherosclerosis. Or it can be a paradoxical embolus, which would be an embolus originating from the venous system, in the case of a patient maybe who has a patent foramen ovale. So the embolus occludes the recipient site, resulting in symptoms that are sudden and usually maximum at the beginning. Unlike thrombosis, multiple sites within the different vascular territories may be affected when the source is the heart. Right, going into the risk factors. So we've got the common risk factors that most people know about. So the high BMI, a sedentary lifestyle, sleep apnea, heavy alcohol use, smoking or other drug use like the amphetamines, diabetes, cardiovascular disease, excuse me, dyslipidemia, and high blood pressure. And then we've got other risk factors that are maybe less common, like in the case of blood disorders, patients with antiphospholipid syndrome, protein S deficiency, sickle cell disease, and many others. And then also important to note that infectious and inflammatory conditions such as pneumonia, HIV, Crohn's disease, ulcerative colitis also increase the risk of developing a stroke. All right, so when we are approaching a patient with neurological symptoms, it's important for us to have an understanding that there are actual stroke mimics. So these can be metabolic, infectious, neurologic, or actual toxins. So the most important under the metabolic, or rather the most common, would be the case of hypoglycemia. Patients with hyperglycemia can also really present with neurological symptoms. So we've got Bell's palsy on there under the infectious, and then also drugs and toxins, like I said, like the amphetamines, that also can cause those symptoms. So the initial phase of assessing a patient with a stroke, it includes addressing airway, breathing, and circulation, promptly correcting any factors that are contributing to the patient's condition, and also determining